As COVID cases among children skyrocket, so are parents' fears. Pediatric hospitalizations doubling in 15 states.
Certainly a concern about how much infection we're seeing in kids.
But experts say it's important to look behind the raw numbers. Of the 53 million known infections in the U.S., children account for just a fraction, 7.5 million since the start of the pandemic. But a shocking third of those cases from the last 4 months alone.
The symptoms are very mild, just a low-grade fever.
Karen Goldschmidt's 1-year-old tested positive last week.
I just feel like we're at this point of we've done everything we can, my husband and I, to protect them and keep them safe and healthy.
In the last month, adults hospitalized with COVID increased by 38%. Pediatric hospitalizations rose at nearly double that pace. New York, Illinois, and several southern states driving the surge.
What is leading to this increase in hospitalizations among kids?
So when you have hundreds of thousands of people that are infected within a small region within a couple weeks, you will definitely see increased admissions.
But those pediatric hospitalizations are not necessarily all for COVID. They also include children who may have gone to the hospital for another reason and tested positive there.
That doesn't necessarily mean that the children are admitted for acute COVID illness.
It remains unclear to what degree Omicron is responsible, and COVID in general does tend to be less severe in kids, but doctors warn it still shouldn't be overlooked.
Even if it's a small number, these are essentially preventable deaths or hospitalizations.
Health experts say the unvaccinated account for the majority of pediatric COVID hospitalizations, urging parents to vaccinate their kids. Just 14% of 5 to 11-year-olds have gotten both shots.
Thanks for watching our YouTube channel. Follow today's top stories and breaking news by downloading the NBC News app.